Fazio. I'm a cosmetic urologist at Miami Men's. In terms of options for penile enhancement, malenhancement, penile enlargement, whatever term you prefer, Himplant is not the only option out there. It's really the only one that I focus on and the only one I offer, for good reason. You know, anyone with a medical degree or with a degree as a nurse practitioner has access to some of these other treatment modalities. And so there are a lot of people out there without any specialized training in urologic anatomy and surgical training whatsoever who are offering some of these other treatments. And so they've become very accessible for patients. And I think sort of some of the inherent barriers to performing implant have made it so that these other procedures become better known and again, more available throughout the country. I don't offer any of these because, well, two things. One, they don't look good. I think they all fail to provide any sort of significant benefit in terms of providing a natural appearing enlargement of the penis. They tend not to meet guys' aesthetic goals. I think if a patient were aware of what he's actually getting himself into with some of these treatments, he probably would not actually pursue them. And they're not functional. You think about the implant, one of the things that's nice about it is it maintains a cylindrical form of the penis. It maintains the normal rigidity that a guy needs for sex. With fillers, whether they're talking about hyaluronic acid, silicone oils, or fat transfer, and we'll sort of put those all into one group, the guys end up with this sort of ballooned out look that's very soft in all states. So not only doesn't look good, it's not functional. So that's my sort of my basic take on alternatives to the implant, but I'll also be able to go sort of step by step and give an idea of how each one works and why I specifically don't offer them. Perhaps the most common alternative to a silicone implant is the injection of hyaluronic acid. Hyaluronic acid, again, it's going to maintain this soft sort of ballooned look for patients. Guys oftentimes decide to go for it out of a sense of desperation and also availability. So there's a nurse practitioner around the corner, a general doctor around the corner offering this procedure. The price point's a little lower than say a implant, and it seems less invasive. I think that's how guys get hooked into this sort of procedure. I think if they were well informed about what they're actually receiving for that price, if they're looking at sort of the quality of the procedure, if they really were aware of what they're opting to do to their penis, which for most guys is one of their most prized possessions, I think saving a few $1,000s for these sort of procedures would be an obvious poor decision for most patients. Unfortunately, I think most of them are poorly informed at the outset about it. So again, hyaluronic acid, not functional. So guys end up with this sort of soft layer of tissue around their penis that does not feel or perform very well during sex. It doesn't look good. Again, swollen, rounded, and soft. It can become infected. While the hyaluronic acid can be dissolved in many cases, it doesn't always work terribly well, and some guys can get some fibrotic nodules under their skin. So not a great option. Another option, which unfortunately was revolutionized here in Miami, was the injection of silicone oils under the skin. So anyone driving up and down I-95 will see billboards for male enhancement, and these are usually silicone oil-based injection clinics. Again, typically not performed by a urologist, typically not performed by a surgeon. Aesthetically, similar result to hyaluronic acid. Rounded, not natural looking a penis. Again, same functional deficits. From a safety profile, these are far more dangerous, far more damaging than hyaluronic acid. They can't be dissolved. Removing them surgically is a nightmare. I've done a few of them in the past. So certainly something a guy does not want to do. Fat transfer, again, seems like a reasonable choice for a lot of patients. This one's common in Turkey, where a guy will have liposuction and that fat is injected back into his penis. Similar cosmetic outcome, again, rounded, not natural, really prone to these fibrotic nodules. So guys will have these just massive lumps and bumps on their penis. The functionality is not there, and it's a real pain to remove this afterwards. And we have quite a bit of experience of guys coming back from Turkey where they were promised some sort of revolutionary penile enhancement, and they end up with a very disappointing and non-functional look. Many of my patients, they'll come in, they'll say, well, I know about suspensory ligament incision, and there's a plastic surgeon in town who does it, and why don't you do it? Suspensory ligament incision, it's a great idea. Conceptually, it seems to make a lot of sense. There's a small ligament at the base of the penis that anchors it to the pubic bone. And the purpose of this ligament is to sort of allow the penis to follow its normal upward trajectory with an erection. And by incising or cutting that ligament, the penis relaxes a bit and hangs a bit lower. So that's the theory. The reality is that it tends to scar right back up. The gains that are achieved through this, even if there's no scarring, are very modest. And for this reason, this has really fallen out of favor, and you only typically find a few guys who don't really have any other tools in their toolkit who are still offering it. I don't like this procedure in guys with a Himplant because it tends to destabilize the penis and allow the base of the Himplant to sort of shift down below the pubic bone. So again, not something I offer. I'm staring at the suspensory ligament during the Himplant procedure. I don't touch it. There are some procedures that can be done that don't directly involve the penis that can result in an increased penile length that are reasonable. And we're not talking about fillers, we're not talking about suspensory ligament incision. We're talking about altering the surrounding anatomy to sort of give the appearance, or at least increase the visible length of the penis. So a few of these are addressing suprapubic fat. So the fat up above the penis, this can really hide significant portions of a guy's length. So over time, as our abdominal wall and the suprapubic fat move outwards, guys can lose multiple inches of their penis. And so by reducing this fat, a guy now has actually exposed significantly more of their penile length. So this can be achieved either through liposuction or just through a mini tummy tuck. So that, of alternatives to Himplant, that's certainly a reasonable option. Another one is to address something called a peniscrotal web. So a lot of guys, if you look at them from the side of the lateral aspect of their penis, you'll see that the scrotum inserts on the underside of the penis, again, sort of obscuring the junction between the penis itself and the scrotum, resulting in a decreased appearance of penile length. And this can be sort of cut out to increase the accessible length of the penis. And so a lot of guys end up doing a combination of the peniscrotal web excision and some suprapubic lipo by altering the surrounding anatomy to increase the appearance of the penile length. So certainly reasonable options for guys who ultimately do undergo a Himplant or opt not to do the Himplant. But anything else involving fillers or injections is certainly not recommended.